News this morning. If your child suffers from an inflammatory bowel disease, the dedicated team at Helen DeVos Children's Hospital is here to help. Today we have Dr. Deb Cloney, Section Chief of Pediatric Gastroenterology, here to talk to us about how they promote a child's comfort and work towards symptom-free living. Good morning, doctor.
Good morning.
Nice to have you on the show.
Well, thank you for having me.
Well, tell me a little bit about, we were talking a little bit before the show about the difference between irritable bowel symptoms, or the syndrome, and this inflammatory bowel disease. There's a definite difference between these two. Can you make that distinction for us first?
Definitely, even though they sound very much alike, they're very different. Irritable bowel is more of a symptom-type syndrome of abdominal pain and diarrhea, whereas inflammatory bowel, like the name would suggest, causes actual inflammation of the lining of the GI tract and much more serious symptoms.
Okay, so the symptoms for one, diarrhea, okay, the symptoms for inflammatory bowel disease, you said much more serious. How much more serious are we talking?
Well, we're talking about blood in the stool, anemia, weight loss, growth failure, in addition to those basic GI symptoms of diarrhea and abdominal pain.
And I'm assuming this can happen at any age.
Yes, it can, and I think a lot of times people think inflammatory bowel disease is a disease of adults, but it's not true. Over 25% of kids with IBD present at less than 18 years of age.
Tell me a little bit about what you are doing at your practice and here at Spectrum on if the children need to come see a specialist. What's the first thing? I'm a parent. I'm seeing blood in my child's stool. Maybe I have that in my stool. I'm going to walk into your door, and what's the first step?
Well, the first step, of course, is getting a thorough history and doing a physical examination, but quite often we'll need to do blood work, and we may need to do radiology testing and maybe endoscopy testing.
Okay, and when you say history, is this something that can be genetically passed on through your parents?
Yes, it can. There is a genetic predisposition. So in other words, you inherit the tendency to develop the disease, but there's more to it than that. There's probably triggers that occur that make the inflammation start up.
Okay, I should probably ask though specifically, if I'm a parent and I see this happening in my children, at what point do I go, okay, I need to see a specialist? I mean, is it the very first time it happens, or should I wait? You know, parents obviously want to make sure they're taking care of their kids, but don't want to be crying wolf.
Right. Well, the first step is always seeing your primary care doctor, because there'll be lots of things they'll be able to do. They might want to work your child up for infection, etc., before they would send you on to a specialist.
Okay. And then what about treatment? When it comes to treatment for this, what do you and your team offer?
Well, we offer a lot of support, number one.
Okay.
Nutrition is important for inflammatory bowel disease, but that's not all there is to it. But we do have a dietitian who works closely with our families. But quite often medications are needed, and that's where we come in and guiding the family through what our medical choices are and making a plan for each child as an individual.
Okay, and I've been through this somewhat, at least in this, I'm at the same party, let's just say, with my eldest daughter. So I'm familiar with the brat diet. Is that something that is part of what you're talking about when you say your dietitian gets involved?
Not so much the brat diet, because that can be very limiting in calories. So we're looking more at how to give enough calories and help the child determine what foods irritate and aggravate their symptoms.
Okay, and that's normally what the cause of an inflammatory bowel disease is? Is it something that you're putting in yourself that's causing the problem?
Diet is not the cause, but diet can affect the symptoms, can make the symptoms worse sometimes.
Okay, and didn't you guys just win a big old prize? Don't you have a gold star on your fridge?
Yeah, we do.
Okay.
And obviously, DeVos can't take this personally because it's a prize for Improved Care Now, which is a quality improvement network that we are part of.
Okay.
But the Drucker Prize was quite an honor, because that means we used innovation in determining how to provide better care for our patients and involving the patients and their families in this process.
Well, let's talk about the Helen DeVos Children's Hospital Pediatric. I mean, just a quick humble brag about what we have here in this community when it comes to taking care of our children. I remember I'm a transplant to West Michigan. I'm a transplant to Michigan, and one of the key factors I wanted to take advantage of by living here was that hospital. Your pediatric system and the healthcare that you offer kids is really unmatched across the country in some ways.
Absolutely. I mean, virtually every subspecialty of pediatrics is represented there. Most divisions have multiple doctors as part of their division. We have 5 physicians, 4 nurse practitioners, and take care of a variety of patients, not just inflammatory bowel disease, but many other GI illnesses.
Well, I can't thank you enough for your time and for the information that you've given us. If this is something that you're going through, you make sure you want to make an effort to get out to Helen DeVos's Pediatric Gastroenterology Department. It's located 35 Michigan Street Northeast, Suite 4150. go see Dr. Cloney or give him a call, 616-267-2100. Make sure you're taking care of not only your health, but of course your children's health as well. Thank you, doctor.
Thank you.
Appreciate the time.